As a community, we've had to change the way we do things. Wearing masks, washing hands, and maintaining social distance has become the new way of life. This has changed the way we interact with those around us, such as our friends, families, and neighbors. As community members of Mitchell's Plain, preventing the spread of COVID-19 is our responsibility. COVID-19 is a virus that spreads mainly between people who are in close contact with each other, typically within 1 meter. A person can be infected when droplets containing the virus are inhaled or come directly into contact with the eyes, nose, or mouth.
Wearing masks is an important way to help prevent people from getting and spreading COVID-19. A mask offers some protection to you, as well as protecting those around you. Masks should be worn in addition to staying at least 2 meters apart, especially if indoors around people who don't live with you.
Types of masks. Cloth masks should be worn when you're around people, whether outdoors or indoors. Make sure that cloth masks are more than one layer. Scarves made of thin fabric are not sufficient. Disposable masks should be worn when you're around people as well, indoor or outdoors. The mask should cover your nose and mouth completely. Make sure the disposable masks are clean and dry. Do not wear masks with vents or openings, as this doesn't provide protection. A cloth mask can be worn over a disposable mask. N95 masks should be prioritized for healthcare workers only.
Face shields are not as effective at protecting you or the people around you from respiratory droplets. Face shields have large gaps below and alongside the face where your respiratory droplets may escape and reach others around you and will not protect you from the respiratory droplets from others. A face shield can be useful when interacting with people who are deaf or hearing impaired. When using only a face shield, choose a face shield that wraps around the sides of your face and extends below your chin, or a hooded face shield. Wash your hands after removing the face shield. Avoid touching your eyes, nose, and mouth when removing it.
Washing your hands. Wash your hands for at least 20 seconds. You can hum the Happy Birthday to You song 2 times in order to time yourself. When to wash your hands. Wash your hands after a cough or a sneeze, especially if you cough or sneeze into your hands. Wash your hands after blowing your nose, before and after eating, before, during and after preparing food, after using the toilet, before and after caring for someone who is sick, especially if you have been exposed to bodily fluids, before touching your eyes, your nose and your mouth, when you return from a public outing such as shopping, work or school, after touching commonly touched surfaces such as door handles, public computers or shopping trolleys. How to wash your hands. Wet your hands with water. Apply enough soap so that it lathers and is able to cover every part of the hand surface. Rub your hands palm to palm. Rub the right palm over the back of the left hand, and then the left hand over the back of the right hand. Rub your hands palm to palm with your fingers interlaced. Scrub the back of fingers with opposing palms and fingers interlaced. Then rotationally rub the thumb with your thumb clasped in the palm of the opposing hand, and then vice versa. Rotationally rub backwards and forwards with clasped fingers of right hand in the left palm, and then do the opposite. Then you can rinse your hands in water. Thoroughly dry your hands with a single-use paper towel. Hand sanitizing. Sanitizing does not get rid of all the different types of germs in the way hand washing does. Sanitizer should not be used in place of hand washing and is only useful when there are no hand washing facilities available. Sanitizers are usually used when the hands are not visibly dirty, as they cannot remove large particles. The hand sanitizer used should always have an alcohol percentage of more than 60% in order to be effective against common germs. How to use hand sanitizer. Apply a decent amount of liquid hand sanitizer to the palm of your hand. Do not flick it off, as you will need a large amount in order for it to be effective. Rub your palms together so that the sanitizer spreads evenly over your palms. Then rub each hand over the other so that the sanitizer spreads to the back surface of your hands. Then intertwine your fingers as to spread the sanitizer between your fingers.
How to put on a mask. Wash your hands or use sanitizer before putting on your mask. If washing your hands, you must wash them for at least 20 seconds and dry your hands with a clean paper towel, then throw away the paper towel. Check the mask for any defects such as a tear or missing ear loop. Throw away any masks that are defective. Make sure the exterior side of the mask is facing out away from your face. Fit the mask snugly against the sides of your face, slipping the loop over your ears or tying the strings behind your head. Make sure the mask is completely secure. Make sure it covers your mouth and nose so that the bottom edge is under your chin. Note that if you have continually adjust your mask, it doesn't fit properly, and you might need to find a different mask type or brand. Once the mask is on properly, then you should wash your hands. How to take off a mask. Wash your hands before removing the mask. Do not touch the inside of the mask. It may be contaminated from your breathing, coughing, or sneezing. Untie or remove the ear loops and remove the mask by the straps. Try not to touch the insides or outsides.
How to wash your mask. Reusable masks should be washed whenever dirty or at least once daily. Always wash your hands after handling or touching a used mask. Masks can be washed by hand or by laundry machine. When using a laundry machine, you can include your mask with your regular laundry. Use regular laundry detergent and the appropriate settings according to the fabric label on the mask. When washing by hand, wash your mask with tap water and laundry detergent or soap. Thereafter, rinse thoroughly with clean water to remove the detergent or soap.
How to discard a single-use mask or surgical mask. Single-use masks that have become soiled, damp, or crumpled must be discarded immediately. Take off the mask from your face carefully. Hold it by the ear loops, not the mask cover itself. Try put the mask in a sealed plastic or paper bag and put it in the bin.
The pandemic is far from over. We all need to do our part to stop the spread of COVID-19.